I would go so far as to say I was lucky enough to have a healthcare scare in high school. Patients becoming impatient entrepreneurs or patients really advocating as much as they can for others is incredibly powerful.
Welcome to Stories of the Relentless, turning straw into gold in a world full of no. Powered by the American Heart Association. I'm Lee Shapiro, volunteer chairperson of the board of the American Heart Association.
And I'm Lisa Sunan, managing partner at American Heart Association Ventures.
At the American Heart Association, our mission is to be a relentless force for a world of longer, healthier lives. That means accelerating bold ideas and the bold people behind them, and demonstrating resilience when the challenges seem overwhelming. Dr. Nanette Wenger is one of those stories. Born to Russian immigrants in 1930, she overcame gender prejudice to become one of the first women to attend Harvard Medical School. She was the first woman fellow and chief resident at Mount Sinai Hospital in New York City. She was also one of the first and most forceful voices to call for greater inclusion of women in medical research, publishing the seminal paper on cardiovascular health and disease in women in 1993, when literally no one was talking about the topic or believed it was worth studying. Spoiler alert, the naysayers were wrong. Dr. Wenger was instrumental in the adoption of a federal rule that women had to be included in clinical trials, and that happened in 1993. Still active, she is now widely considered the mother of the field of women's cardiovascular health.
Today we have the pleasure of speaking with Surbhi Sarna, another woman who saw the future and made it happen. Shortly after college, no less, Surbhi started her first company, Envision, which focused on a medical device to treat ovarian cancer. This was a topic that at the time was not yet high on the industry's priority list, but became a breakout success nevertheless. Particularly important now as people are recognizing the importance of ovarian health in women's health overall. Today, Surbhi is a serial entrepreneur. She started also Collate and a former general partner at Combinator, and she was the first there to focus on healthcare and life sciences. She's a known voice and trusted mentor in the healthcare world and dedicates meaningful time to bringing others along with her. Having overcome great odds to become a successful entrepreneur and investor despite being young, inexperienced, female, non-white, non-physician, and a stranger to the venture capital landscape. Surbhi, it's always wonderful to speak to you, and especially so today.
Lisa, thank you so much for having me.
And Surbhi, what great attributes. This podcast is focused on standout healthcare leaders who have a relentless commitment to success and making a meaningful contribution to our field. You wrote a book called, without a doubt, Go from Underrated to Unbeatable. What's been the most important driver of your ability to be unbeatable, and where did this come from?
I think it all goes back, to what you said to start with, which is having a dedication towards life science and sort of knowing where that comes from and why healthcare matters so deeply to all of us. And, I would go so far as to say I was lucky enough to have a healthcare scare in high school. I had repeat complex ovarian cysts. And the first couple of times it happened, I ended up going to the hospital and having, sometimes extended stays. It was extremely painful. And even once the physicians were able to tell me that I was suffering from complex ovarian cysts, the things they couldn't tell me is whether or not that cyst was cancerous. And, it turns out after further diagnosis and that sort of thing, the cysts resolved on their own and they were not cancerous. But at the time, I spent, a year going to the library after school, reading journals about my condition, spending time with my beloved biology teacher to understand my condition more deeply. And so I think at a very young age, it was rooted in me that if you don't have your health, you don't have anything else. And that bringing innovation forward in the healthcare space, basically nothing is more meaningful than being able to do that and positively impact someone's health.
Wow, that is a really interesting lesson to learn early in life because most people don't pay attention to it till much later when it's getting kind of late. So I can see that would be a very formative impact for you.
It is. It's something that I keep top of mind, even today, and I don't take a day of good health for granted. Like, I often think about it even now that, and then some people could say, that is, too fear driven, but actually for me, I think what it does is instill, gratitude, just gratitude for what we have.
That's awesome. That's very motivating, actually. All those challenges I listed, age, gender, experience, lack of the network, all of it. What was the most difficult to overcome? Or was there one in particular that you really think about a lot?
Yeah, I have thought about this question quite a bit. And I think that as I have put on more years of experience since then and I reflect back on it, I think that it's quite difficult to sort of untangle all of the different aspects and kind of pinpoint to one thing because at the end of the day, when I present as a human to another person, is they're actually assessing everything that you just listed, holistically, at the same time. And so it's really hard to point to one. I will say that, you know, my first company, it took me about 2 years to raise $250,000, and even when I raised that $250,000, it was tranche, so they gave me 125,000. Yeah, isn't that something?
Dollar a day.
Yeah, exactly. It's like $1 a day, actually, yes, to, get to a prototype, and then they gave me the other half of it, and now, I still have some of the same attributes that I had, but of course, it's, what is it? I started that company when I was 24, I just turned 40, so it's 15 years later. I do have significantly more experience, but this time for this company, it was, much easier to raise those initial funds.
Well, I think also women's health, especially then, was just not a topic that people talked about or cared about, aside from women, who weren't the VCs at the time. So it's really interesting to think now you're doing something that's a little more generic in terms of the market opportunity, not gender based. And so it probably also makes a difference in how the world
Oh,
perceives it.
absolutely, absolutely, right? When I was going out to fundraise for my first company, honestly, one of the things in the Bay Area that got people, whether it was right or wrong, but got people talking about like women in the workplace and women's issues was Lean In. And when I went to go fundraise, like Lean In wasn't even written. Like the new wave of feminism that's entered, the Bay Area, it wasn't quite there. VCs, I still remember they would put things on their website like a good pitch is like a good bathing suit. Don't reveal too much up front. So and back then it was, like, okay to put this on your website, so
Applies to men too, actually.
I know, I know, especially men.
Serby, though, do you think that in the last 15 years, you've talked about Lean In and your experience, is it easier today based on your trailblazing for women to raise money in the marketplace?
I mean, I can only pray for that to be true, I don't know, I hope so, I know that I tried my hardest at YC to kind of instill certain things around funding more and more women, to bring more women to entrepreneurship. I can um, hopefully say, with some accuracy that I do think the Envision exit to Boston Scientific allowed quite a few funds to form,
Yeah.
a handful of funds to form that were, dedicated to women's health because at the time it was one of the larger exits that had happened in this particular space. And so it makes me feel good that funds dedicated to women's health would put Envision on their exit slide as, an example of what can happen when you invest in women's health, and that other founders that were working on women's health could put Envision on as an example. So whether or not it actually helped, I don't know. I really hope so. But hopefully it was an example for people.
Yeah, I mean, we certainly are seeing movement here. It's one of those 50-year overnight success things, but it's getting better for sure. Your company, Envision, the first one, not the current one, maybe it was too, but the first one was certainly founded out of your personal experience. And we see that a lot in healthcare, which is not true in other industries as often, I think. But in your view, How do you make that kind of experience translatable to the masses? I mean, one's personal healthcare experience is not always translatable on a scalable way to the masses. What was different about this for you and for the market?
Yeah, that's an excellent question. Thinking about my current company now, what we do is we use AI to accelerate medical devices and drugs getting to market. And many of my early employees either had a personal health scare or they had a loved one who suffered from a healthcare incident. So I do think that those of us who felt it personally will always be more driven towards contribution, not that you have to be, you know, but I think that patients becoming impatient entrepreneurs or patients really advocating as much as they can for others is incredibly powerful. And I think, you know, to your question about how does it scale, I think sometimes it's making those people believe that in that moment they can use their voice or whatever natural talents that they have to kind of spread the word about what they're going through. It's sometimes really hard to talk about when you are going through a healthcare issue. I remember specifically when I was having these ovarian cysts and these incidences, I was sitting in Spanish class and I had the cyst ruptured. And I remember like passing out on the ground temporarily and then getting up and walking to the nurse's office. And the Spanish teacher, not meaning anything, said in Spanish to the kids, her ovarian cyst ruptured, which of course the high school boys interpreted as like my ovary ruptured. And, you know, so talking about, and that was fine, to be a sophomore and go through that. Uh, but, you know, it's hard for anyone to talk about the health related issues that we're going through. But I do think it's really, really powerful for other people to hear. If we
Mhm.
are willing to talk about it. I do
Well,
think
yeah, for sure. I mean, it's so true, and I think normalizing that language and the thing by regular human biology is so essential. We started talking about Nanette Wenger at the beginning of this podcast, who's really a living legend in this field of women's health, and you started in this world in 2012, which is incredibly early from an entrepreneurial standpoint when you think about women's health successes. Getting it from start to profitable exit, when you got it acquired by Boston Scientific, as you mentioned, I think that was 2018, right? So when you think about, back then, the medical device market generally was starting to really contract already. It's never uncontracted. It stayed, smaller ever since. The women's health market was something you didn't say those words out loud. The women entrepreneurs were not in the room mostly at that time, except for maybe me. How would the journey have been different if you were taking it today, or would it be different? Would it be the same or would it be different?
do you mean from an external circumstance or an internal
Yeah, I mean, obviously your own personal circumstance is the same, but do you think it would have been an easier road? Do you think it would have been the same? Do you think that the objections would have been different? How do you think there would be a difference if you started that company in 2025 or 2026 instead of in 2012?
think so. I think there would have been different because since then I can think of quite a few, both female founders who've seen really significant success and
Mhm.
companies in the healthcare space. So I like to think, and maybe it's just wishful thinking, but I like to think that, if today I was to start a company and I was in the same age and the same level of experience, that it hopefully would be a little bit easier than it was.
Mhm.
When you kind of reflect back on your career, because you went from entrepreneur to investor and then back again in terms of an entrepreneur, but you joined Y Combinator. And so you went to the other side of the table, so to speak, as an investor.
Dark side.
How did that change kind of your view about entrepreneurs and startups? And what do you take away from that experience at Y Combinator?
Yeah, that's an excellent question. And I'm incredibly grateful for my time at YC because I think that a lot of the lessons that I learned there, have shaped again the type of founder that I am going into this company. I think that it's very, very different being in the shoes of somebody that is, building a company and there every single day versus someone that's on the other side evaluating it. I think the biggest difference between, being in venture and being a founder is that when you're in venture, your success is in multiple bets. It's in like multiple ideas, multiple people. And, there is just a limit to how deep you can get into any one subject because, you are spread among, very different opportunities some of the time. When you're a founder, and I know this is not an attractive word, but I unfortunately think that it is an accurate one. You are completely obsessive about one topic, about one product, and how to make that one topic and one product with that one team successful. And it's basically, outside of my kids, it's like all I'm thinking about now. And so there's sort of a different level of focus and relentlessness and dedication um, towards one cause versus having the other side of it, which is also really fun, which is sort of understanding many different spaces, many different, opportunities, many different people. And so, I would say I would just remind founders out there that VCs will never know more about your space and your opportunity than you do. So I would just be a little bit careful to let VCs validate whether or not what you're working on is um is a good idea. Now, the flip side of it being in venture is I do really like more quickly realize when founders are working on smaller markets which are not venture backable. And I think
Mhm.
there's like a difference between working on a good idea that is sustainable versus being venture backable, And
Mhm.
so I find, founders when they're even asking me for advice now, not totally able to tease apart that difference, and how it really depends on size of the fund as well, So I would just say that the venture person that you're talking to, understanding the size of their fund and the type of returns that they were expecting, for it doesn't mean that you're not working on something extremely valuable. But what happens as a founder, you go out there, you talk to a VC and they reject you and you take it personally instead of understanding that it's just like the market. Like the market doesn't support, venture backing, if that makes sense. And I just think that as a founder, I just did not realize how frequently the no's were based just on that and just on that alone.
Interesting.
This is just in the venture framework,
Right. Yeah, I mean, 95% of businesses in America are not venture backed, more than 95% probably. They're small businesses, quote unquote. Some of them are incredibly valuable, incredibly profitable, but not everything needs or should have venture capital backing, I think is your point, right?
Yeah, exactly. I mean, how many industries are there where there are just like mega companies, even if we had time to talk about like the 100 biggest companies in the US right now, how many of them started with venture dollars, right?
Yeah,
So,
probably very few of them. Yeah.
yeah, yeah, it's exactly right. So it's
Yeah.
not every business needs venture, as a founder, you don't need venture. There's like other ways that you can go about doing it. And just if you are going to take venture money or put yourself through that, the other thing that happens, on Lisa, I'm sure you've seen this as well, is that let's say that you're working on an idea that's not venture backable, but that's the path you want to go in. Your first check's coming from angels who really believe in you.
Mhm.
And they don't necessarily know that there's not gonna be anybody for that next round of funding. So I just think it's, in general, a good idea for founders to really, like, triple check the math and make sure, like, at a fundamental level, is there truly a market for this? That being said, like, in my case, people would think that it was a small market with Envision when it was not. So,
Mhm.
I think sometimes there's a bias towards certain things being a small market when they truly aren't, like women's health, for example, is not a small market. Um, but yeah, that's what I would say to founders is like, it's not, I would take everything very personally the first time around. And now being in venture, I sort of know there's a lot of different things that go into making a funding decision.
Yeah. It's so hard to distinguish sometimes between what's a good idea, what's a good business, what's a good investment, and also between what's, a good idea and what's wacky, right? I mean, like, there was a time people thought interventional cardiology was wacky. Nobody's gonna go through people's arteries and things like that to do these procedures, and now it's the norm, right? So the few bold people who took a chance on it, they did well.
I think it's the
Um
hardest part about, like, venture actually is, like,
Mhm.
you hear something and sometimes it is just, like, completely off the wall, but you're like, "Well, if this works, it'll be
Yeah.
huge."
Suspending your disbelief is half the
Yeah,
battle.
yeah, absolutely, and so sometimes it's like the wackier the idea sounds and potentially the bigger opportunity, but then also the mo the opportunity to be like, "That was so obvious, why did I not see that that would never work?" You
I
know?
know. I know. I remember first hearing about Uber and being like, "Nobody's ever gonna get in somebody else's car. Are you crazy?" And you think about Envision's deep clinical company, now you're doing Collate, which you can tell us a little bit about. That's more about the process side of healthcare. Tell us the problem you're solving there, first of all, and then how is this process different when you're working on process and operations versus clinical? How do you think about different headwinds? What are they? And, maybe the second time around is different no matter what, but what is the difference you can pick out that's related to the focus?
I love that question. I've always been flirting with doing a second company. Like from the day I joined YC, I think most people around me knew that that temptation wasn't completely gone for me. I have experience where I could do another, medical device company. I could go into drug development. I could go into that core work, and I was really tempted to do that. But see, for me, what drives me the most is impact or my interpretation of impact, right? Not saying that it's correct. So I did Envision because I really wanted to have a new detection mechanism for ovarian cancer on the market. Then I did YC because I thought what could be more impactful than funding 50 healthcare, life science related companies a year. And then when I was thinking about what to do next, basically through YC and watching these various companies that I was funding, but also Envision, also being at Boston Scientific, being at Abbott, I realized that often the blocker of getting these life-saving drugs and devices to market is not actually the idea or the concept or the design. It's all of the operational stuff and the paperwork you have to do from,
Mhm.
the initial thinking of the idea to getting it to market. Because every single thing from R&D, manufacturing, reimbursement, regulatory, marketing material, post-market surveillance, it's littered with paperwork that someone has to do.
Yeah.
So then I thought, okay, when I first like this latest wave of AI came out, and these LLMs came out, I basically immediately started flirting with, well, how, like, from my personal experience being the person that wrote all of this paperwork, how can I use this to help other companies, big and small, get the products to market faster? And I just thought, this is one of the few opportunities I'm going to have in my lifetime to sort of completely turn upside down the methodologies that we use today. I think that it's literally a 5x acceleration that I think that if we execute properly, we can bring to market.
Collate, as you're talking about it, sounds like it was a big overlooked opportunity. It was not a sexy idea. It was one of those places where you felt that since you were dealing with it, maybe others needed to do that as well. As you, again, reflect on your view of the market, what you saw at YC and being an entrepreneur, where else do you think entrepreneurs should be focusing right now that maybe isn't getting a lot of attention or funding, but could create the next big winner?
Yeah, I mean, that's a really interesting point, right? Even though AI is sexy right now, AI documentation just didn't like sound interesting to other people, right? They're like, "Oh, AI for drug discovery, AI, for, whatever it might be." But AI for like writing the documents, like less interesting, and I think that's why even though I didn't leap immediately because, I have young kids and I took the decision to start another company like very, very seriously. So it took me almost a year. Why, there weren't that many other people on the market really working on it or had raised a lot of money to do it, because it didn't sound, yeah, it didn't sound that sexy. But I think paperwork is sexy, and I think it's meaningful work. So I'm happy to do it. Yeah, in terms of other areas where founders should be focused, I will be like honest with you. These days, I don't really think much. I don't really think about much else outside of the scope of what I'm working on. But what I will say is that people tend to overlook their own backgrounds and how valuable their own experience is. So they they're like, "What company should I start? What idea should I start?" And they'll basically look at everything else besides the job they did in the past, right? So, like Coley, for example, it really is to make the job I did in the past easier. And that's what makes a founder fit so strong is that, I kind of know what to build because I did all of this myself. Sometimes people will look at but YC taught me not to do that. YC's big thing is really focus on the experience you've had, the industry you've been in, what role you played in that industry, and then work backwards on how you could have what is the product you would have used while in your job. That's like a central tenet to YC and finding founders. So we, would often look for that particular thing. If somebody wanted to do something, in healthcare or banking, what did they do previously that made them sort of an area expert at this one particular thing?
I could probably sit here for hours and hear what you have to say, but I wanted to get to a few lightning questions before we close.
Yeah.
And just kind of give us what's the first thing to come to mind. So, first question, what is a sacred belief you had early in your career that you found out was wrong?
That all people are a good fit for any job if they try hard enough.
Second question, how did you define success early on, and has that changed?
I define success the same way, and it's working on products and with people that want to make a real impact in this world.
Awesome answer. And last question for you, what's the most important leadership lesson you've learned and that you'd be willing to share with everybody else?
I think that there's no replacement for hard work, and everybody around you will only work as hard as you do. And I just think that we went through COVID and society has gone through different phases of belief in, how much time people should be spending at work. And I think that if you're working at a mission driven company like we are at Colate, just hard work is an essential part of it. But I do think, as a leader, if you want people to be dedicated, you have to lead by example and show that dedication and really put in the time and focus that's necessary. In addition to, of course, caring about these people as individuals and what makes them happy on a day-to-day basis, part of that is not expecting from them what you're not willing to do yourself.
Yeah.
Surbhi, so wonderful. Thank you so much. This was awesome.
What a fun conversation. Yeah, thank you so much.
What a terrific conversation with Surbhi Sarna. I mean, I've learned so much talking about curiosity. I mean, her desire to know more about her own condition, what drove her to start her first company, and gratitude. That was so important from her. And then the difference between success for venture and success for a founder. Success comes from multiple bets, but an entrepreneur or founder is obsessively focused on that one thing and has expertise, and they should never forget that expertise. Two other really fine points that they showed. One, the wackier the idea, the bigger the opportunity. And that paperwork is sexy. I never really knew that before, but she clearly thought that that was the case.
Everybody has their own definition of sexy, and honest to God, companies that do really, really well and make people, make great impact and have great returns. That's kind of sexy if you're me. So I don't know. If you enjoy this episode, please subscribe. Please tell your friends and share it with your network. and leave us a review if you would. It helps amplify these stories and the mission behind them, which is everything to us.
Follow the American Heart Association on LinkedIn and YouTube for more conversations like this one. They're all great. You can download this episode and the full series of Stories of the Relentless wherever you get your podcasts.